That is an excellent question, and I'm going to try to explain it as best as I can in a short video. The general recommendations to everybody, regardless of their conditions, is, move more, eat better, sleep more, get outside, whichever. Of course, the nuances of it should be individualized, but generally, this is like the tips and tricks of living a healthier life. Normally, as you eat, your body takes up sugar, it gets sensed by your body, your pancreas secretes insulin, and then insulin either pulls that sugar into cells to either be used then and there, or it stores it for a rainy day. Then what is insulin resistance? That is when your body needs to secrete way more insulin to get rid of the usual amount of sugar you needed to previously. Then what causes that? That could be things like having excess fat around your organs so that the cells can't penetrate to get the sugar out, or being inactive, or getting older, or certain rare disorders, whichever. And you might be thinking, well, then how can I treat insulin resistance? The same picture I showed before. Knowing that someone has insulin resistance can drive the motivation towards living a healthier lifestyle, but the risks of being on things like medicine and the like outweigh the benefits that you get from it purely from just insulin resistance without diabetes. What is diabetes? Remember, insulin resistance means your body needs to secrete more insulin to get rid of the same amount of sugar you needed to previously. Diabetes means that now that insulin resistance is so far gone, it can't get rid of that extra sugar and now it's just floating around in your bloodstream. These yellow globules is in a normal blood vessel, it's a lower amount, and then this is diabetic, it's floating around a lot more. One of the ways that we test for diabetes is not by testing an insulin, it's in fact testing for an hemoglobin A1C. Since all of us have sugar in our blood, sometimes sugar hitches a ride in one of our blood cells. But since in diabetics there's way more sugar floating around in their bloodstream, there will be a higher percentage of hemoglobin with sugar molecules attached to it. Once you hit a 6.5% rating or higher, you get the diagnosis of diabetes. Now it is at this point where the consequences of insulin resistance could catch up to someone, and then medication is needed to keep them safe while they go back to the general recommendations of how to keep someone healthy. Diabetes is by no means a death sentence, but the idea of using medication means that now the risk of gathering a complication of diabetes like retinopathy, nephropathy, neuropathy, all of these things, the benefits of the medications outweigh the risks. And of course, utilizing the tips and tricks of living a healthier lifestyle can also reverse some of those complications and even diabetes itself. Don't get scammed, take back your health.